I work in a community health center, which is a health center, not a mental health center, but a primary care practice with a family medicine residency as well. And I work in the clinic and work with family medicine faculty and residents, as well as pharmacy students and residents in the clinic. I love my practice. I think the great thing about working in a primary care practice is that the family medicine physicians are comfortable in taking care of patients with depression and anxiety and some of the basic mental illnesses, but once it gets a little complex, they come and seek my help, and that's the beauty of working in that setting, is that they actually ask for help. There is such a great need in the primary care setting for clinicians who can provide care for people with mental illnesses. Most times patients with mental illness want to be taken care of in the primary care setting, and with the lack of access oftentimes to psychiatrists, that's where the care is provided.
My practice site is located in Central Appalachia in a rural setting. I work with a team of 5 physicians and 5 mid-levels in a patient-centered medical home, providing care to patients with mental illness, psychiatric illness, and neurologic illness on a daily basis. What I enjoy most about my clinical practice is actually seeing the patients individually, being able to spend time with them, do a thorough mental health evaluation, and then working with the primary care physicians and our counselors to form a bridge therapy where we can provide medication therapy management and provide referrals to psychiatrists if needed.
I am the pharmacy director at the San Antonio State Hospital, so I have the duties of being the pharmacy director at that facility. Also, I have a unique position in that I am the pharmacy services director for the Department of State Health Services, so I have the opportunity to help guide pharmacy services at the other state hospitals in the state of Texas. And this may include writing policies, working on their statewide P&T committee, and developing drug guidelines for the agency. I got interested in administrative pharmacy because I saw there was a lack of leadership within our agency and felt that there was a need and that I could have an impact not only in our patients but throughout the state facilities within Texas.
My practice site is a bit non-traditional. We are a private company that partners with the North Carolina Medicaid system to develop treatment algorithms and educational materials and practice improvement materials for primary care physicians. I have the opportunity to work with a bunch of highly motivated individuals. This is a new program in North Carolina, and I found that the primary care physicians are hungry for the kind of information that psychiatric pharmacists can bring to the table.
My practice site is a large children's hospital with psychiatric services both in a separate inpatient facility for psychiatry patients only, as well as some beds in the main hospital. I enjoy the ability to integrate translational research with clinical practice. So we don't have a restrictive environment of research or clinical practice. We have an interface and multidisciplinary team that we approach the patients specifically with respect to adverse effects like the metabolic effects of antipsychotics. This specific area of psychiatric pharmacy practice was very interesting to me because the nature of psychiatric disorders is that they're lifelong illnesses, and some of the medications can be taken for a lifetime and can cause lifetime adverse events. And being able to see children and adolescents who may be medication naive and may have first episode illnesses gives the opportunity to be aggressive with treatment, inappropriate, and to be able to look at the long-term effects of the antipsychotics specifically, and to be able to try to mitigate those from an early time in illness.